Hello, my name is Trent Posterior and I'm a student physical therapist, and today I will be demonstrating the posterior rotation of the clavicle at the SC joint, also known as the sternoclavicular joint. So the first thing to notice is that the SC joint is located right here. The structures to take note of is the sternum, and the specific portion of the sternum is called the manubrium, and the clavicle is attached to the manubrium, and the clavicle comes out and is attached to part of the shoulder girdle. This assessment is important because with any overhead elevation of the upper extremity, you have rotation of several joints, and one of those joints is the SC joint. Dutton Orthopedic Examination, Evaluation, and Intervention textbook describes that the angle of the joint, the SC joint of the manubrium, is orientated 20 degrees posterior lateral to accept the convex head of the clavicle. In between the manubrium and the clavicular head is articulating disc. That disc is a saddle shape, which means that the arthrokinematics are going to be reversed based on which direction you are moving. During protraction of the shoulders and retraction, you have a concave on convex orientation, and during elevation and depression, you have a convex on concave orientation. During overhead motion, however, you just have a spin of the clavicle in a posterior direction according to the articulating disc. So when the arm is elevated overhead, the clavicle rotates posteriorly. Malcolm Peet in 1986 described that the average rotation of the clavicle is 50 degrees posteriorly when the when the arm is elevated maximally. He also stated that if the clavicle is not allowed to rotate at all and is completely immobile, that there is only 120 degrees of flexion at the maximal amount. I will now demonstrate this on a patient. On this patient, you're going to have the patient lie supine with them closest to you on the side that you're assessing. I will instruct the patient that I will assess their non-affected side first, and so they understand what is being done, and also to get an idea of what their normal is on their non-affected side. For the sake of the time for this video, I will just be assessing this side. Right here, as I'm palpating, is the clavicle as it comes across and attaches to the acromion. And then over here, I'm on the manubrial notch, and right here is the SC joint. So that is the joint that I am assessing. During this test, one hand can be placed on the sternum, specifically the manubrium, and that will be stabilized, and one finger can be placed over the joint line. The other hand is placed in the middle portion of the clavicle, and then I'll ask the patient to actively elevate their arm, and I will assess the posterior rotation of the clavicle. During this video, you'll notice that my fingers might disappear behind, and it might be difficult to palpate the last few degrees of elevation due to the approximation of soft tissues as the clavicle rotates behind the soft tissue during elevation. During this technique, it is important to keep in mind body mechanics, so the table should be about at the wrist level or finger level. So now I will instruct the patient on what I am doing and for him to perform the test. Devin, I'm going to assess your SC joint. This is a joint that's located right here. This joint is important for overhead motions of your arm. You've said that you've had some difficulties, so I just want you to raise your arm over your head, and I'm going to feel on your chest what is going on. All right, I want you to raise your head or your hand over your head for me. as much as you can and back down. One more time. All right, good. And then one other time, if you just want to assess the motions, you can have them raised from there so you're inside and you get the full degree of motion. And that is how you perform the posterior rotation assessment of the clavicle at the SC joint.